Good afternoon, everyone. Today I am going to discuss about the hormonal health. Uh, First of all, why it is important to know about the hormonal health? Because hormones are the main thing which improves the quality of life. Uh, Usually, when they are haywire, we experience certain health issues, symptoms, mental means moods ups and downs, and then low energy and all those things. So it is very important to know about the hormones and how the health, physical health and mental health is go hand in hand. So today I'm going to talk on thyroid, PCOD, and obesity, and how to take back the control of your health with a simple and practical tips from my side. So, if we discuss about the hormone, what are the hormones basically? They are chemical messengers in our body, which are secreted by the gland, and they travel through the bloodstream to control everything like a physical health, mental health, weight, fertility, moods, and energy. Okay, so even one or more hormone which is disturbed in our body can ripple your health like anything. So, if we look at the thyroid hormone, which controls the metabolism and energy in the body, insulin, which regulates the blood sugar, and sex hormones like estrogen, progesterone, testosterone control reproduction and cycles in the body. There are several other hormones also, but we are going to talk only about these three hormones, which are very commonly encountered in the health conditions. So, before going into detail about the hormones, the most important and very commonly cases which we see it on daily basis is hypothyroidism. So, this thyroid disorder, it's became like a silent epidemic in India nowadays. Almost 1 in 10 women are affected with the hypothyroidism, and this is almost a 10% of India's population. This is more common in women, almost three times than the male population. And most of the time, 60% cases are undiagnosed and or they are unaware that they have a thyroid issues. So the thing is, before going to the next slide, I will just go through a real life scenario or my own patient with how the patients will come to us. So usually, when we say about the hypothyroidism, there are several types of thyroid disorders, which we called it as a Hashimoto's thyroiditis. It's due to autoimmune condition, which is the most common condition for the hypothyroidism. Hypothyroidism means your thyroid levels in the body are less, and because of that, you are having the symptoms. So, autoimmune means what? Autoimmune means your own immunity is attacking against your thyroid disorder, thyroid gland, which is the most common cause. Second one is a iodine deficiency, especially people who stay in hilly area or inland regions of India. They will have iodine deficiency related thyroid disorders. Certain medications like lithium, which we give it for depression, or somebody has undergone thyroid surgery, has received radiation, can get thyroid problem. And many times postpartum means post pregnancy or post delivery, excess stress can cause the thyroid problems. What are the symptoms? Symptoms could be fatigue, excessive tiredness, weight gain, feeling of cold means you feel always better in the hot weather, brain fogging like poor memory and concentration, excess hair loss, depression, low mood, slow reflexes. So these can be symptoms of hypothyroidism. Many of times we see these symptoms very often, which could be correlated with something like lack of sleep, or certain, like if you have a hair loss, we say that yeah, Bangalore water is hard, so I am having the hair loss. So many times these cases go unrecognized where you have a thyroid problems. Now, if we look at the lifestyle or how to manage the thyroid disorder, the diet plays a very important role, especially in case of iodine deficiency thyroid problem. Like the food, especially the raw cruciferous veggies like cabbage, cauliflower, broccoli, these are called as a goitrogens, and they can cause sometimes iodine deficiency and hypothyroidism. So, but if you cook them well, usually they are harmless. Soya products, millets in excess, processed food um, can cause thyroid hypothyroidism. Millets in excess, I am telling, it's not the regularly. If you means you are not taking any other carbs, complex carbs in your diet and only eating millets, especially in people who are very diet cautious and they are following certain diets, they can get the hypothyroidism because millets will have lot of thiocyanates which will reduce the iodine absorption. um, so what food we should eat? We should eat more iodine-rich food like iodized salt, dairy, selenium source. Selenium is also important for the iodine absorption and thyroid function, which will be present in sunflower seeds, eggs, lean protein, colorful vegetables. You should eat all color vegetables. I always tell that you should eat one fruit a day, and you should keep changing your fruits on a daily basis. Means if you eat banana today, you should eat a pomegranate or apple or berries on the consecutive days. Fiber rich diet, whole grains, these will definitely help to improve the thyroid problems. So, how to manage these things? One I have discussed is a diet. Second is a medications. People who requires means if their TSH levels are really high, they might require the thyroid replacement tablets, which can be taken on empty stomach. Regular thyroid monitoring, TSH test every 3 to 6 months are important, and most important thing is a stress management like yoga, pranayama, adequate sleep is directly supports to the thyroid function. And we always say that whenever you on any thyroid medication, avoid calcium supplements, iron supplements, tea, coffee, breakfast within, tea, coffee within 4 hours of thyroid medications, and at least keep 1 hour break after taking your thyroid medications to take anything orally, which will block the absorption of hormone. So, the one good case I want to discuss here, I had one patient who was rushed to my OPD. She was a very young lady, and she was very anxiously came into my room saying that she wants to discuss the reports with me, and she had a concern having a low vitamin D. So I asked her like, why did you do this vitamin D test? So that time she told that 6 months back she had the similar complaints of tiredness, fatigue, and that time her vitamin D was low, and one of the physician has given her vitamin D injections, and then after that she was started feeling better. But when I looked at her, she was very anxious. I just held her hand to check her pulse, which was she was sweating a lot, and her pulse was bouncing like anything. So I asked her, "Are you feeling any kind of palpitations, or you feel your own heartbeats?" So she was like, "Yes, the I feel like my heart is racing like anything, and night time I feel very much uncomfortable, suffocation." Uh, she had almost 8 kg weight loss in last 6 months, and then she was having a lot of anxiety, lack of sleep. So later, when I discussed with her and asked, "Have you ever checked your thyroid profile?" So she said 6 months back we have done and it looks normal. It was normal, so I didn't check this time. So she had a concern that it might be just due to vitamin D deficiency, and she wanted me to prescribe vitamin D. So I did that, and I told her, "You do one thing. I will write one more tablet. You come back tomorrow with the thyroid reports. We'll see that." And when we checked her, I have written one tablet for her. And next day, she came back to me in the OPD saying that, "Doctor, what you have given, it was a wonderful pill. I am feeling great. Since last 6 months, I have not slept. I was having a lot of palpitations, anxiety, uneasiness, tiredness. Everything has disappeared just with the one tablet." So then she did the test and it was showing like her TSH was very high and she was feeling the symptoms. So this was the case of hyperthyroidism. Hyperthyroidism, in these cases, you have an excess of thyroid hormone. So when there is an excess of thyroid, basically thyroid hormone works as it increases your metabolic rate. So you might feel like racing of your heart. You can feel weight loss despite good appetite. You can get tremors, anxiety, irritability, excessive sweating. Sometimes people can have fever kind of a symptoms, bulging of eyes can happen. But the treatment is very simple. Sometimes we just have to give certain few days medication as a course and they are all right. Sometimes we have to continue anti-thyroid medications for quite a longer period, radioactive iodine therapy, or some people may require surgery in selected cases. But if we won't treat this hyperthyroidism, it can strain your heart and it can cause heart muscle weakness as well. The most important, I feel, nowadays, what we come across is PCOD. PCOD or PCOS. What is PCOD? PCOD is polycystic ovarian disease or polycystic ovarian syndrome. Polycystic, cyst means a fluid filled cavity. So, for women, usually every month, one egg will be released. So this egg has to break to release the yolk. And if this egg is not breaking due to the hardening of the eggshell, it remains as a small cyst. And next month, again, the new cyst will form. And it's like that, it forms a multiple cyst in the ovaries. The unbroken eggs will stay in the ovaries and it causes PCOD. It is the most common hormonal disorder in women, and almost 1 in 5 women in India are affected with the PCOD nowadays. Uh, the ovaries, which produce the excess hormone, the androgen, which is actually a male hormone, which disturbs the menstrual cycle and causes multiple small cysts, as I told, that is called the PCOD. It closely linked to the insulin resistance, stress, and lifestyle factors. So, if we discuss the main cause for the PCOD, which we see is insulin resistance. So, what is insulin resistance? Insulin resistance. See, insulin is a hormone which takes the glucose from your blood and it pushes inside your cells. So whenever the insulin resistance develop, like insulin resistance means when the insulin gives the glucose to the cell, then only the cells will get glucose and they will feel energetic. So if you have an insulin resistance, the cells will not get the glucose what the insulin has brought. Means cells are not recognizing insulin and they are not opening the door to collect the glucose. So when the insulin stays outside the cells with the glucose, they think what we should do now, and they start insulin converts that glucose into fat, and the fat or obesity increases, and it causes more visceral fat, which causes this PCOD problem. It increases androgen, male hormones. Okay, so the base of the PCOD is mainly the insulin resistance. It is not only with the diet, it is with the sedentary lifestyle and with the stress, which is much more uh, cause for the insulin resistance. So, insulin resistance, genetic predisposition, chronic stress, sedentary lifestyle, and poor diet are the causes for PCOD. What are the symptoms? You can experience irregular periods, adult onset acne, facial hair, which we call it as a hirsutism, hair thinning, weight gain, and many couples feel difficulty in conceiving. How we can prevent? Maintain healthy weight, reduce sugar, processed foods, reduce sugar and processed foods, manage stress, and exercise regularly. Here, the exercise is the most important thing in PCOD, especially we advise women to reduce the abdominal fat. Uh, why we are more worried about the obesity here? Because if we look at the fat, fat is not always a good thing. There are two types of fats in our body. One is a white fat, other one is a brown fat. The brown fat is a good fat, which helps for the giving us insulation, prevents from the cold. It prevents us from the lot of infections. But uh, white fat, it generates the lot of inflammatory markers in our body. So when this white fat and the visceral fat increases, there will be lot of inflammation in the body. So if you are experiencing inflammation in the body, like heat, lot of heat in the body, or you are getting boils, skin changes, acne. See, many of the times the adult onset acne or pimples are first starts with the painful inflammation or painful pimple on the face, and then it becomes gets infected and forms pus. But not always these pimples comes like that. There could be just a pigmentation of the skin. It could be pigmentation over the neck or armpits. Your armpits are getting black. Okay, that also could be sign of insulin resistance. If somebody is getting new skin tags, that also could be resistance. Skin tags means new moles on the body. That also could be a sign of insulin resistance. So it is very important, and nowadays there are certain tests which we can detect the insulin resistance in early stages, and we can treat it either with the lifestyle managements or with the medications. But lifestyle changes are the first line. There are certain medications like we give oral contraceptive pills, metformin, and some fertility treatments if it is required under doctor's supervision. Uh, this oral contraceptive pills also usually it's been given because in PCOD there will be a lot of excess surge of certain hormones like LH, male hormones like testosterone. To suppress that and to bring down the level of certain hormones, they give the oral contraceptive pills. The next one which we see is um, menopausal or perimenopausal symptoms. These changes are real, invisible roller coaster in uh, menopausal age group, like 40 to 55 age. There are several symptoms that can cause hot flushes, sleep disturbance, mood swings. Sometimes the family members also experience that the anger bouts, irritability. But why it is important to know that whether you have any hormonal changes in this thing, because after a certain age, after perimenopausal age, when the estrogen effect goes down, you are susceptible with the cardiovascular shifts, like postmenopausal, the risk for cardiac diseases will increase. So you need to monitor your lipids, blood pressure, sugar, and lifestyle factors very closely. Even the bone and metabolic health also gets interrupted postmenopausal. It accelerates when the estrogen effect goes off. It accelerates the bone density loss, osteoporosis risk, fractures. So in this case, also doing a regular DEXA bone scans or meeting a doctor, taking calcium supplements, it is very important. The most important thing in all the hormones, I feel obesity is the very important aspect nowadays which we go through. Whenever we deal with the obesity, it is not only the it's not only about the appearance, but obesity, it increases the risk for diabetes, heart diseases, joint problems, PCOD, and thyroid dysfunction. As I said, the white fat or visceral fat, when it increases in the body, it causes a lot of inflammation. And if you look at certain conditions, the inflammations that triggers process like atherosclerosis. Like that's why the more risk for the heart-related issues or brain strokes can be uh, increased due to obesity. So if you look at the approach in case of obesity, whatever the diet, exercise, intermittent fasting, what we do, the maximum thing uh, can be achieved if we treat the obesity together, like with the diet, exercise, and medical treatment. For all patients, they don't require the medical management, but diet and exercise. If you look at this uh, bar diagram also, like diet alone can increase the average almost 4 kg weight in 6 months. Exercise alone, it can reduce up to 3 kg weight in 6 months. But diet and exercise, if goes together, it can reduce almost 8 kg in 6 months. Intermittent fasting, yes, some people can do it, but what we have seen that when you go back to your normal diet, you will regain the weight. Though you lose weight very fast, maybe 6 kgs in 6 months, but you might regain weight after you leave the fasting. And with the medical treatment, you can go up to 10 kg or even more, we have seen. But sudden weight loss also, it's not a very good thing. We should go always step by step, and combining diet, exercise, and medical treatment is always good for the obesity management. Obesity, we say when your BMI is more than 24, but nowadays, even means 23 only we consider as a obesity. uh, how to deal with the diet? The Indian diet makeover, replace all these simple carbs. Simple carbs means uh, rice, white rice, maida, even these are the simple carbs. Even millets, these millets, wheat, whatever you take, chapati, these are also simple carbohydrates only. But because millets will have the less glycemic index, less sugar levels in that, they are better than the processed simple carbs like maida. Uh, so they are more preferred. I usually recommend that you should have more complex carbohydrates in your diet than the simple carbs. Complex carbs means all fruits, vegetables, whatever the green vegetables. Green means not only leafy green vegetables, but whatever looks green to your eyes, like bhendi, karela, gawar, these green gourd, bottle gourd, these are all good as a complex carbs. All the fruits are good for as a complex carbohydrates. So replace the simple carbs with lot of complex carbohydrates. Stop using added sugars, uh, sugar, jaggery. These are all like uh, added sugars we have to reduce in our diet. Reduce intake of oil, increase vegetables, and prefer home cooked diet. Exercise every day. I usually recommend doing a moderate intensity exercise on daily basis because it has more cardiovascular benefits than doing a high intensity workouts on weekends. Because I have seen many of my patients, because they don't get much time during weekdays, they go to gym only twice in a week, and because of guilt that I have not done the exercise in the day weekdays, they do a lot of high intensity workouts or do some this 100 meters 100-kilometer cycling or something like that on weekends. So for all those people, I will recommend that rather than doing that, because when you don't do exercise in the weekdays, your body is not conditioned for that, for the high intensity workout. And when you do the high intensity workouts, you get more muscle wear and tear than getting a cardiovascular benefits. But if you go for a brisk walk for 30 minutes at least every day, it gives more benefits than doing high intensity workouts on weekends. Plus, so ideally 150 minutes per week moderate cardio plus 2 to 3 days in a week strength training uh, is helpful. If I have to prescribe a exercise, uh, medical options to control the obesity, we have to discuss. Nowadays, there are a lot of options to control the obesity, uh, especially for people whose BMI is more than 30. There are the GLP-1 analogs, very easy to use nowadays, weekly one subcutaneous injections, or even the tablets are available to control your weight or to reduce those uh, who has a high BMI, or people who has a BMI more than 28 but having the um, uh, hypertension, diabetes, or something like a sleep apnea. We can even start these GLP analogs even if the BMI is more than 28. Bariatric surgeries are for the morbid obesities, especially those who has BMI more than 45. Nowadays, after the GLP-1 analogs has come into market, and they are quite a proven in the weight loss studies. So bariatric surgeries are like we are uh, saying only after the all other things has been tried medically. So this was about the obesity. So I will just discuss about the your health action plan if you have any hormonal issues. To usually the most important thing is a routine checkups, because most of the hormonal issues we get discovered by doing regular health checkups. So annual thyroid, blood sugar, hormonal panel you have to do. Uh, Eating mindfully, whole food, less sugar, iodized salt, more fiber, and crash diets. Avoid crash diets, it is important. Doing regular exercise and strength training, as I told. Manage your stress level. Chronic stress definitely it disturbs hormones. Breathe, sleep well, seek support when needed. I feel the sleep is the most important thing. Those who are dealing with hormonal issues, uh, these hormones are very much sensitive for the timings. So when you sleep on time, wake up on time, your following the biological rhythm of the body, these hormones will stay in a better conditions. Otherwise, they can go on roller coaster. Breathing, deep breathing exercises, definitely yoga, deep breathing exercises, they definitely help to control the hormonal issues. So I would recommend that at least 20 minutes meditation or deep breathing exercise everybody should start doing. And never self medicate, see your doctor on time. Hormonal conditions are manageable, uh, and it improves the quality of life if you get the right guidance and get the right treatment for that. So the last one, that thyroid disorders, PCOD, obesities are manageable and not a life sentence. With the right knowledge and consistent care, you can live full healthy life. Thank you.